If I was diagnosed with something terminal as a hospice nurse, this is what I'd do. In this video, I'll discuss what I would do as a hospice nurse if I was diagnosed with something terminal. Things like how would I navigate the healthcare system, what decisions I would make, and I'm going to share a story that may also help paint this picture. Generally speaking, I think all your decisions you make about your healthcare should be your decision, of course, and I would want to support anyone in that. But this story in particular kind of sheds light on how I think education may have helped this person possibly make different decisions. It was a young patient of mine. She had very young children and she had metastatic breast cancer. Now, once I got to know her very, very well and we were talking about things, I discovered that basically she had a type of breast cancer that would have been very survivable. She wouldn't have to be on hospice if she made different choices, if she chose to get the standard of treatment. A type of surgery, a chemo, radiation. She could have lived. It was a survivable cancer. She didn't have to die from this cancer. However, she chose not to do those things. And again, I want everyone to do whatever they want. So this is no shade to her if that's what she wanted to do or she didn't believe in that and those things. However, that wasn't really the case. I feel like she just didn't fully understand the urgency of what was going on with her, and she didn't really take the necessary steps she needed to help her survive. And now she's a young mother on hospice dying. So it was a really, really sad story. We obviously treated her pain and did everything we could to help her have a peaceful death, and she did. But that is why I'm making a video like this. I want people to fully understand what I would do and different options you may have if you are diagnosed with some kind of cancer or some kind of terminal illness. So what would I do? No matter what the disease is, if I was diagnosed with it, either knowing it was life-limiting or knowing that it would be like the type of cancer that will eventually kill me, I still would fully look into what the standard of treatment is. Many diseases have a standard treatment. It's like with this type of cancer, we have found we do X, Y, and Z. That's the standard treatment. And we've found that it helps you live X amount of time. Sometimes that's forever, you can be cured, right? Or sometimes we found that most people, live for 5 years, 7 years, 10 years, things like that. So know the standard of treatment and if your specific disease has one. Not every cancer has a standard of treatment. There's sometimes several different options, but many of them do. For example, certain colorectal cancers, right? They know we do this type of surgery, then we do this type of chemo, then this type of radiation, and that's going to extend your life for possibly or probably 10 years, which is still not long and it's still a hard road, but I would always do those things. I would always do the standard treatment. I would definitely seek out doctors that I liked, that I wanted, that I respected and trusted, but I also would not delay my treatment. So I do think it's important to try to find the right doctors, but we all know our healthcare system, it can take so long to get into places, right? So I would probably make sure I was quick about getting treatment versus like making sure I had the most perfect provider. I know it is, it's iffy. I hate even saying that, but I just want to tell you what I would personally do. Personally, I think I would want a great provider, but also would want to get the treatment started ASAP. Navigating the healthcare system. Now, this one is a doozy, and I always think about this, how I'm so lucky that I'm a healthcare worker, so I kind of know how this world operates. But if you don't, you're going to be confused and possibly angry because you'll see people aren't talking to each other, you're getting things done, the other people don't know what's happening, and you're kind of like, isn't anyone reading the chart? Doesn't anyone know? The truth is, not always. And that's not necessarily their fault, or it doesn't mean that they're incompetent. It's kind of like we all have these systems in the hospital and not everyone knows each other's systems and not everyone talks to each other. That's crazy. I get it. Our healthcare system is not working out that great, but that is the truth. And it doesn't necessarily mean someone's negligent, unfortunately. So it's important for you to know what you're doing, to know your test results, to tell your doctor what's going on. Don't just think they know, because they might not. They might, but they might not. So always be the one that is providing information to everyone that you're working with, because you might be working with an oncologist, a radiologist, the surgeon, the different nurses. They might not all be talking. So you have to be the one, unfortunately, I'm not saying this is right, that is in the know and you're telling them what's going on. So we all are on the same page. I would also be talking to my healthcare providers very openly. I would want to know, what is the progression of this disease? What is this going to look like? How are the medications that you're giving me, how are they going to affect me? Now, just because they may affect me negatively, right? I still will likely do them if that's the standard of treatment. Okay? The standard of treatment, I do believe personally, will help you with survivable outcomes. A lot of times people will hear like the chemo is going to do X, Y, and Z, and it's going to impact you negatively, right? So they go, oh, well, then I don't want the chemo, which again is okay if that's what they want. But I think it's important to know what that means if you don't do the chemo. Right? I've seen a lot of patients on hospice who maybe didn't need to be on hospice, but because they refused a lot of things, maybe because they didn't know all of the facts, they are now on hospice prematurely. Again, I keep wanting to reiterate, it's totally okay if that's what you choose and you fully know what's going on, but sometimes you don't. So make sure you fully understand, ask questions, ask them about the progression of the disease, ask them about side effects and how they're going to help you with that. Ask to be on palliative care if you can. Not every hospital will provide that, but I would 100% get on palliative care if I could. So it depends on the hospital and how they use palliative care, but many hospitals will let you on palliative care and there's literally no downside. They're only there to help you and manage symptoms. Also, my state of mind. My state of mind will be really important for me if I was ever diagnosed with some kind of life-limiting illness or if I was diagnosed with something terminal. I would consistently remind myself that this is likely going to be what ends my life. Now that sounds really morbid, but I promise you the way I would do it would not feel morbid. It would help me get to a place of acceptance so I could live each day knowing that I'm dying soon. And I really do believe, because I already kind of live that way already, because who knows, I may be dying soon, you never know, right? It helps you live in the moment, it helps you live in gratitude, it helps you truly prepare for the end of life because you are knowing this is likely it. So I need to do this now. I think when you don't do that, you live in this like, I'll do it later. I'll push it off. Not right now. I'm gonna look over here and we're gonna push that off till later. And that kind of thinking causes problems because it's always later. You never address it until suddenly it's in your face and now it's too late. So my state of mind during that time would be kind of how it already is because I already live like that. I already contemplate the fact that I will be dying, and I'm telling you, that has truly helped me live in the day that I'm in, fully and free. And last but definitely not least, I would be prepared in my mind knowing when I'm going to want to say enough is enough. And those signs to me would be if I was frequently having to go into the hospital, I would start perking up, maybe enough is enough. If a doctor is telling me, hey, we've tried everything and there's not really much to do except, because they always will do that. No offense to oncologists, but they usually always try to go, except you could try one more waka waka. That's my cue. No. Knowing when to call it quits, knowing when because it is a personal decision, when I want to call it quits. And I think many more people would call it quits sooner if they worked in the healthcare system and if they saw this all the time. I think our healthcare system does a poor job at really helping people understand when enough is enough. And I think it's really important as a healthcare provider who's an educator online to kind of talk about that. We definitely don't cut it off, I believe, when we should. So if I was ever diagnosed with something terminal, I would hope and pray, I'd put my money where my mouth is and know that enough is enough. And a lot of times you start seeing signs, and those signs are you're in and out of the hospital all the time. There's a doctor telling you, we've tried everything, there's not much more we can do. They either stop there or they'll say, but you could try this, or maybe there's a clinical trial here, or maybe go on to palliative care, get a little stronger, and try chemo later. If you ever hear a doctor say that to you, I'm sorry, doctors, when I say this, but no, that's a cop-out. because I've seen so many patients on hospice tell me that. My doctor said, I'm just going to go on hospice until I can get a little stronger to try another round of chemo. And I know by looking at them, because I've been a nurse for a long time, that that's not going to happen because they're at the end of their life. But no one was willing to say that. So if you ever hear doctors say that to you, I think confront them and say, do you think I'm at the end of my life? Because that is what I think you are. So as a healthcare worker, me, if I was in that position, I would know, ding, 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 it's time for hospice. It's time for hospice. Meanwhile, this whole time, right, I've been preparing myself for this. So it's not fully shocking that it's happening because I have already known that it would eventually come to this. Does that make sense? At the end of the day, it's always your own personal decision, but now you know mine.